Community Hotline is made possible with generous support by the Mount Hood Cable Regulatory Commission. The Mount Hood Cable Regulatory Commission advocates on behalf of the public interest on communications policy issues at the local, state, and federal levels.
Hi, and welcome to Community Hotline. I'm Monica Weitzel. We're here in Gresham at MetroEast Community Media. Thanks for joining us tonight. We're going to start out tonight talking about healthcare for all Oregon. And to talk about healthcare for all Oregon, we have Representative Terry Rogers. Thank you for being here.
Thank you.
And Norman Sylvester, local musician and my friend, who is going to be here to talk about the event that you helped spearhead to raise awareness and funds for healthcare for all Oregon.
Monica, thank you for having us here. We're honored to be here.
Thank you. It's a pleasure. It's truly a pleasure. I can't believe it's been this long that I've never had you on the show before.
It's been a while, huh?
Yeah, that's
but it's
good.
always a good place to start.
Yeah, okay. Sounds good to me. Sounds good to me. So, Terry, maybe you could start out telling us a little bit about Healthcare for All Oregon, what your mission is and what is the reason for this organization.
So Healthcare for All Oregon was founded in 2010, and we have been in the we've had a bill for universal access to health care in every session of the legislature since 2011. Wow. This is an important topic. It's going to take a long time to really make health care affordable and universal. We often use the term single payer, which is a wonky term, but it's really like Medicare, where the federal government is the single payer, but everybody gets to choose their doctors. Okay. And you know, the elderly really like Medicare. They say, don't mess with my Medicare.
Don't mess with my Medicare, yeah.
And so we are an advocacy organization, which means that we work in local communities and at the state level to try to achieve a really sensible organization of healthcare, not necessarily health insurance, but real access to healthcare. Okay. Not unlike the Canadian system, which, although people say that people come to America for quicker care, in fact, the Canadians love their healthcare system.
Is that right? Yeah.
Yeah. So we have a bill in the legislature again this year. We'll have a hearing on April 20th, and Healthcare for All Oregon will have its lobby day in Salem on April 20th. We also work in local communities. Ashland and Corvallis, in the election in November, passed resolutions in favor of universal access to health care, which is wonderful. Yeah. And we do a fundraiser each year with Norman and a lot of other volunteers. The musicians are not volunteers. They get paid for their work.
That's good.
It's Saturday, April 22nd, and it is really, really a fun event.
Right.
I know Norman's going to talk about that. And I know what is on people's minds nowadays is Obamacare and Trump care.
Well, it's confusing for people, you know. And when I'm hearing about Healthcare for All Oregon, I'm thinking, okay, how is this different from Obamacare or from what Trump is proposing? So can you give me just a kind of a brief synopsis of how it's different, or what is perhaps better about the plans that you have as opposed to what we have already?
The biggest difference is you would not have private insurance companies. And so if you don't have private insurance companies, you can save an incredible amount of money and cover lots more people. And the goal of a universal program is to cover everyone. So, you know, the insurance companies pay their stockholders money in dividends. They pay enormous CEO salaries. They pay incredible amounts of money to
Administration fees,
lobbyists.
yes.
And you have thousands, actually, of insurance companies, and they all have their own forms.
Right.
One of the simplest things that could be done, and has never been done in the United States, if they used one form, doctors' offices would not have to have nearly the amount of staff to process these forms, which they hate. So there are a lot of ways to make healthcare delivery cheaper and more sensible. And you know, the European countries all do it. And we work to have it happen here.
So what would happen to all the insurance companies and all those employees and all the people processing the forms and all the administrators? I mean, do people ask you that? Do they say,
yes, they do.
What about those jobs?
They do. And you would need to have some retraining, but there are always an incredible number of jobs. It's one of the fastest growing fields in the United States.
The medical field is,
yes.
yeah.
Yes.
Tell me, what about Oregon Health Plan? How does that factor into all this?
That is essentially Medicaid. And Medicaid is one of the big issues that Obamacare, or the American Affordable Care Act, thanks, made great strides in increasing the eligibility so that more people could be covered in the states that bought in, because the Supreme Court said states did not have to buy in. And it increased the eligibility level, so you could have a little bit more money and still be eligible. So part of the enormous increase of millions of people who became eligible for insurance was through what was called Medicaid expansion. That is hugely threatened by what's going on in Washington, what people are now calling Trump care, and which the Congressional Budget Office estimated that by 2026, 24 million people would lose their health care.
I heard that figure, and that's really scary. That's really scary.
Majority of the musicians that I know that are covered on the Oregon Health Plan.
Is that right?
So that's a wonderful thing for the musicians and independent business
a lot of
artists.
people that use that.
A lot of folks, yeah.
So is that why you got involved in this, or what brought you to try to help raise awareness and funds for this?
Well, this festival stemmed from the original Jam for Jesse Jackson that was put on by the Rainbow Coalition in 1988. That festival ran for 12 years, and it took a little time off. And then a few of the committee members got together and said, let's get the band back together again. And the mission was Healthcare for All Oregon. And we're in our 6th year. And I'm a part of it because it's the right thing to do. As a man of my age, 71 years old, I've been through medical crisis. I've seen my brother and sister musicians suffer from medical problems because they didn't have preventive medicine examinations. So I came on board to make it better for my children and grandchildren and everybody else's children and the future. I think we need to have everybody in and nobody out.
I couldn't agree more. You know,
equality.
I have to say that the musical community, however, the people that have been affected, who have had serious illness, who are musicians, they really come together. They really come together to support each other.
You've seen it, yeah.
I've seen it time and time again.
times.
How musicians are, they're stricken down with with cancer or something happens, and the musical community really supports each other, and I love that. So they're coming together again, to help support the.
But what you just said is really a yay-boo. And musicians who tell their stories to us say, we're tired of doing these performances to raise money.
Well, yeah, they shouldn't have to. They shouldn't have to try to raise money for your own health care. I mean, you shouldn't have to do that. I mean, who else does that, right?
Well, a lot of musicians play benefits.
They play benefits.
Needing a benefit for themselves, you know what I'm saying?
And hoping maybe if they need it, it'll come back, come back around for them.
One thing about music in this festival that Healing the Healthcare Blues, that's why I wrote a song called Healing the Healthcare Blues for this festival. Music is a good vehicle to get the message out, get the word out, because as a musician, I consider myself a healer. Art, music heals, you know what I'm saying? So we can use this festival with all these wonderful artists on April 22nd to continue to get the word out to seek sponsorships, to create partnerships in the community. All of this stuff is a part of that journey. And like she said, it's going to be a battle. It's going to be an uphill battle. Be a lot of work,
yeah.
Like, you know, me being on this show with you right now, we got to start somewhere. Right. And it's a blessing to have all of this network working together. And, you know, this 6th year, and we get about 650 to 700 plus people.
Wow. So tell me about the event then. This is going to be April 22nd.
Right.
And it's at the Eagles Lodge.
North Portland Eagles.
North Portland Eagles
North Lombard and Exeter Street.
Right. And this is from about 6.
Doors open at 5.
5, okay. And there's a dinner if you want to participate in that. Right.
Food for sale there,
okay.
Yes. The community village where we have informational tables, vendors to come in for just various things that, you know, like healthcare,
right.
you know, parental guidance, all this kind of stuff. So we have silent auction.
Okay.
And that's from donations from community partners. So it's a wonderful thing.
Yeah.
And we have, it's not so much a blues festival this year as Americana. We have everything from...
There's some real variety, isn't there?
Variety,
yeah. So I think we have some pictures too, and maybe they can bring that up, and you can tell us about some of the artists, because there's some really terrific artists. Besides you, Norman, who is always a pleasure to listen to. I've heard you so many times, and I always love hearing.
Yeah, we have Boogie together.
Yes, we have. So. Okay, tell us who we're
Okay, that's Shoehorn. He's a tap dancer and saxophonist. And that's the Obo Adi Project, Okrapong, African Ghanaian dance.
Right.
And up there is Bloco Alegria, and that's Brazilian percussion and dance.
Oh, now that one's, I've seen the other two, but I haven't.
So we're starting basically with, they'll be on early, the Ghanaian dancers, and later on we'll bring on the Brazilians. So it'll be like split up a little bit. That's
and that's your daughter, isn't it?
That's my lovely daughter Lynanne with me. That's Paul Knowles and Renee Mitchell, the MCs. We have Ken Body this year as well.
Good.
That's Mary Flower. Tevis Hodge down here playing acoustic guitar. The little guy with the greenish looking guitar, Steve Chesborough. Now these are all acoustic blues players. Piedmont Blues. Tevis Hodge is ragtime and Delta, and Steve Chesborough is Delta as well. That's Mike Crenshaw. He's going to do a spoken word rap.
Good, yeah.
For healthcare.
Cool, yeah. I've heard Mike before too.
Lloyd Have Mercy Jones.
He's been around for a while too.
Yeah. And the Volcano Vixens with
they're always fun.
With the Strange Tones. That's a wonderful show. And then we have the Doo Doo Funk All Stars, which is Tony Ozier, which is the P-Funk.
I think I saw you at the concert out in the park last summer when they were playing.
They're really great because a bunch of young Afro-wearing people, and they get into the show, they're a younger group of kids, and they're just perpetuating that old funk groove, that syncopation of the old days. So we go from the country blues to the funk to Lloyd Jones blues to Norman Sylvester blues to dance and drum and dance.
That's right.
And it's a wonderful thing. And all the ticket information is on Ticket Tomato if you want to find out about that.
Okay.
Yeah.
And this is from last year? Or one of the previous years?
Yeah, one of the previous years, yes. And that's the way the crowd is. There's so many people there, it's really hard to dance.
Well, that's a good thing. That's a good thing.
Yes, indeed.
Yeah. So what are you looking forward to at this event? Is there anything in particular that you're really looking forward to?
I always leave that festival feeling energized spiritually because there's so much love in the room.
It's very uplifting, isn't it, to have a whole community come together for the same cause and music and the sharing. And
KBOO sponsors us,
good.
So that's a wonderful thing. They're there to simulcast.
Oh, good.
And we have 2 stages.
Oh, you do? Oh, really?
Mm-hmm. Yeah.
So there's never a pause.
Never a pause.
I love it. Oh, that's great. So one's done and the other one starts?
Ballroom stage, community village stage.
Good.
Yeah.
And people just have fun. It is a night of great music and a lot of fun.
I remember last year I knew about it and I forgot about it, and I remember driving by because I lived right by there, and I drove by the next day and the sign was up. I was like, no, I missed it. I was so mad. So not this year.
The age group is really cool too, the diversity in the age group.
Yeah.
So we want to reach out to more younger people because the young people got to get on board as well, because it's their future.
They need to
And
get
we wanna
active and
reach
start
out to 'em.
advocating
So
and
as much as we can embrace the younger people, we would love to get the word out to them as well.
Good, good.
Yeah.
Well, and so there'll be information there. So if people,
yeah.
so it's not just a fundraiser; it's an awareness raiser.
There you go.
Yeah, yeah.
Yes.
So will you get up, or somebody get up and talk a little bit about what this is all about at the event?
Yes, it will. It's hcao.org. Correct.
Okay.
For to become an advocate and just sign up and
Okay.
just join the
You
movement.
probably always need volunteers, right, to help do the advocacy work and just awareness raising and
Yes.
maybe go
Educational
table
work.
at a community
Yeah.
event or something like
Yeah.
that. Yeah.
Always need volunteers.
Yeah,
You know that.
Yeah. Yes, I do. Yes, I
You're
do.
surrounded by some awesome volunteers, so
Yeah,
you know.
Yeah, good, good.
Yes, indeed.
Okay, well, we're just about out of time. Any last words, anything else we need to know about the healthcare for all Oregon, or about the event to promote this?
Well, we just want to say healthcare is a human right, no matter who you are. We don't want to discriminate against anyone about anything, but healthcare, preventive medicine, preventive care is what we need to keep families out of the stress mode of losing their properties and
Ending up
going
homeless
into debt.
a lot of times.
Yeah.
I mean, our growing homeless
Which
problem
we're fighting
is
right
part
now.
of
So,
part of that too.
And we appreciate you and this organization for having us here. That makes you one of our community partners, and see, it's just growing. It's getting bigger and bigger.
We'll all hold hands, be singing Kumbaya pretty soon. won't we?
You're singing Heal the Healthcare Blues.
There you go. There you go. All right.
Thanks
Thank
so
you
much.
so much. Thanks,
Thank
Terry.
you,
Thanks,
Monica.
Norman. You
We
bet.
appreciate you.
Thanks a lot.
All right.
Thanks so much for watching this first segment of Community Hotline. We have a lot more coming up, so please don't go away. But check out the websites and get the information you need. Pass the word around, and I hope to see you at their event. We'll be right back. Good job.
Community Hotline is made possible with generous support by the Mount Hood Cable Regulatory Commission. The Mount Hood Cable Regulatory Commission advocates on behalf of the public interest on communications policy issues at the local, state, and federal levels.